All right, and we're live. All right, good morning to everyone. Good morning to our viewers. All right, hope everyone had a good night, a good night's sleep. Of course, we'll be talking about hypertension today, the effects of hypertension, what are the causes of hypertension, and also how to deal with it. Well, I am Brian Thompson. We also have Dr. Navarro with me this morning. Mr. Harold Diaz will be joining us soon on this program as well, right? As soon as he
Yes,
finishes up what he's
yes,
doing.
he's
Right.
been
So,
putting
Dr.
in a
Navarro,
lot of
just give
work.
a little interview of yourself, and then we'll begin.
Well, basically, I'm a naturopathic doctor, but I also qualified in live blood microscopy, FSM therapy. I do ozone therapy, intravenous work um, with hydrogen peroxide. I do also hyperbaric um, oxygen therapy, and of course, nutritional consultant um, as well as well, so many other things. I have a lot of certificates. Well, besides the naturopathy, so I have about 20 years experience in the natural medicine field. So I have a long history working in natural medicine, and of course, but we do use um, normal blood tests, ECGs, echocardiograms, all these things to ascertain a patient. So those are some of the things that we do to assist us in our work here.
Okay, great. Not sure if you'll be able to maybe put up the volume a bit or maybe speak a little louder. Not
Well, I
hearing you
yeah,
properly.
I can't talk louder, but my volume is right up. I
Okay,
think there's a
great.
little
All
issue with
right.
the volume.
No
Yeah,
problem. All right, I'm
yeah, I think
hearing
it's
you
fine.
clearly now.
Yeah,
Of course, to our viewers, those that are viewing, you could ask questions and we'll be able to answer those questions here today as well. Although we're talking about high blood pressure or hypertension, we'll also be answering questions as it relates to any other health complaints. Okay. So high blood pressure, hypertension, of course, this is something that affects, I will say, nearly everyone. All right. Why I will say everyone? Because at some point, we'll have persons where their blood pressure may go high at some point. And of course, why does that happen? Right? Right. This is what we'll need to answer. Why something happens, what are the causes of hypertension itself. Now, hypertension, as we look at our slide here, right, just to make it easier for you. So the first question that comes to mind, Dr. Navarro, what is high blood pressure? Right? What does high blood pressure mean to you? And
right,
then we'll go into the what could cause and the treatments for high blood pressure.
right. Well, high blood pressure. Well, you have the systolic pressure and you have the diastolic. All right. I'll explain what the systolic. The systolic is the operation pressure when your heart pumps. Okay, the artery expands and contracts, right? When it contracts, the top one is the operating pressure in the artery, right? That's the systolic. That's the systolic pressure. When the heart pumps, the blood flows through the artery expands, and we get the systolic pressure, which is the pressure above. The diastolic pressure is when the artery contracts and is in a resting situation, and that is the lower pressure. That normally is between 120, the top, and 80 at the bottom. All right. So you have normal blood pressure, then you have mild hypertension, and then of course you have high, or what I say, um, moderate, and then you have chronic, right? So blood pressure over 140, like 140 over 90, um, and then of course the chronic would be very high, between anything over 180, over 110, 120. right? That's high blood pressure. Okay, that's when it's chronic. Um, well, we won't go into the causes now, but once you are experiencing anything over 120/80, that's the top 120 and the bottom 80, and it starts to elevate, both figures start to elevate, it means that there is an issue happening in your body which is affecting your blood pressure. Now, they have a lot of reasons for people getting high blood pressure, of course. If somebody is not sleeping properly, they could have, for instance, they're not getting good night's rest. Uh, they could be working late or up late at night, not getting enough hours in. The blood pressure could be elevated. Poor diet, of course, is one of the main causes. Um, Also, the lack of calcium and magnesium, especially magnesium, that can affect the blood pressure. And we'll talk about a little bit about that later on in terms of what affects the blood pressure. And it is a serious thing. It is called, of course, it can cause you to get a stroke or a heart attack, and therefore that needs to be addressed. And later on, we're going to give a simple recipe to deal with high blood pressure. Okay?
Okay, great. Right. So definitely, of course, as you said before, the first number, the top number, the systolic pressure, and the bottom number, the diastolic pressure. Now, of course, our blood pressure goes up and down during the day itself.
Yes.
But this is something we generally have to just monitor carefully as we go along, because when a person actually runs, their blood pressure actually tend to go pretty high. All right.
Yes.
So is that hypertension? No.
No,
All right.
no.
That
Because
is
the
the body
body
just
is
regulating
supplying the
properly.
blood to the muscles. So
Right.
the heart has to pump harder. So that's
Mm-hmm.
not high blood pressure.
All right. So when
Okay?
a person reaches in the stage of high blood pressure, of course, there's so many complications that comes with it. So many different symptoms that may also come as well. So we will be going through some of the symptoms and also more or less how to deal with it. As you talk about magnesium, um, that's something we need to expand on the importance of magnesium for persons that actually has high blood pressure, but we're not going to do that as yet. We're going to continue downwards into high blood pressure. Now, at some point, the arteries could become damaged. Now, we spoke about yesterday on our program, we did heart disease. We also talked about atherosclerosis or clogging of the arteries, where plaque builds up in the arteries. Now, as you said before, right, systolic pressure is basically a pressure that happens inside of the arteries, all right? The force of blood on the walls of the arteries, that is basically blood pressure. Now, usually when the blood pressure goes high, there has to be some type of damage to the arteries, right? If it's going high abnormally, because it will go high when you eat, when you maybe sometimes when you're sleeping, it will basically might actually jump up high because the day is very hot, the sun is very hot, your blood pressure may rise. During a very cold environment, the blood pressure will have to rise to get oxygen to the tissues and blood flow. So the heart is actually involved in most of that. All right, getting the blood pressure is like you have a pipe, and that pipe, if it is that you're hardly getting water to the other side, won't you have to raise the pressure in order to get it to the other side? And that's the thing. This particular issue, I won't call it really a disease itself, is an adaptation of the human body. Because when you look at, right, you wanted to come in there?
Yeah, it's a disease that affected by lifestyle and diet.
Right.
It's called a non-communicable disease. So it's not that it's caused by anything but your lifestyle and diet. cancer is a non-communicable disease. Diabetes is non-communicable.
Right. Hmm.
High blood pressure or heart disease is also a non-communicable disease. So it is your lifestyle and diet that is causing this problem. Therefore, it can be addressed with a lifestyle change and eating habits.
Right, but
Definitely.
definitely, as you said, basically come from lifestyle. So more or less, the body is just adapting to what you're doing on a day-to-day basis. All
Right.
right. So if you don't exercise, if you don't really move, if it is that you're not drinking enough water, then automatically your blood pressure actually starts going a little higher than normal. Thickness of the blood, clotting
Right.
of the blood, right? All of those are some of the, let's say, extended complications
Yes.
that will affect the
Also,
blood pressure.
that also what I want to talk about is when people eat a lot of fatty foods, um, the body, the fat, when it gets into the bloodstream, there's damage to the lining of the endothelial lining of the artery, and the body naturally produces plaque. And we actually see it in the live blood analysis, where the plaque is floating in the blood, and it actually goes to the area of where the damage is, and it will calcify the wall. And if the person continues to eat unhealthy, that calcification can grow where it narrows, and that can lead to the heart, or it can, in a case of a stroke, the blood vessel or the artery that's going to the brain, which it could be the carotid artery that goes to the brain. And of course, there are a lot of, as I said, a lot of people have blockages in different vessels to the heart. So if we continue eating and damaging the lining of the arteries, which is the endothelial lining, two things happen. One, there's calcification, which hardens. You also have soft plaque and you have hard plaque. Arteriosclerosis, which we were talking about last time, hardens the arteries, and therefore, what happens in a case like that? Because the arteries become hardened, when the heart pumps, the arteries have very a difficult time expanding and contracting. All right, and of course, that can be caused by some medications like those blood thinners. Coumadin is one of them. Um, uh, I'm trying to remember the other one. Coumadin and warfarin. Those medications, they take you off of green leafy vegetables and a lot of things that help the arteries to become um, healthy. So it removes the vitamin K, which is a very important vitamin, and eventually the arteries become very hard and brittle. Okay, so those are some of the issues. And of course, when you start to calcify the arteries, there's another issue that goes on there. On the walls of the endothelial lining, the artery produces something called nitric oxide, which is super important for good blood flow throughout the body. All right. So what you find is a lot of people who are diabetic and hypertensive. This increases uh, day by day. Depends if the blood sugar is high. Usually, when the blood sugar is high, the blood pressure goes up as well. And of course, there is damage every day until it reaches a significant point where the patient can suffer a stroke, they can suffer renal failure. That's another thing too. All these are complications due to high blood pressure. They can lose their eyesight as well. Their eyesight becomes worse over a period of time because the blood pressure is damaging the blood vessels in the eyes because the high of the because of the pressure inside the blood vessels.
Right. So definitely, um, that is a lot of information there for persons to take so that they'll be able to work on the prevention. Of course, better to prevent than to have an event that takes place that will cause your life to be in danger. Now, one of the thing with high blood pressure is that you will never know until you test. So if a person, because there are minimal symptoms that you'll actually see when it comes to high blood pressure, all right, very minimal. Some person may get like, let's say, like a little neck pain that might come, but that could be just a neck pain. That doesn't have to be high blood pressure. Some person may get a little chest pain, all right, that could be a problem of the heart itself. That doesn't mean that the person have high blood pressure, because I've seen person where they get chest pain and their blood pressure is normal. So it's important to really test that blood pressure. All right. And the kits that that you'll get into the pharmacy, they're not expensive. It's something that you could actually keep at home in case of any emergency. You feel maybe a little lightheaded. You feel that you sometimes person feel like your blood is rushing to the brain. All of that could be little signs of high blood
Yeah,
pressure.
yeah, lightheadedness too. You might feel dizzy, lightheaded, you know.
Hmm.
Also, those are signs that you can it can affect you as well. You know, I know the headaches is one, um, and of course pain. Sometimes people in pain, when you're in pain, the blood pressure goes up as well.
Definitely.
You know.
Yeah. So you always have to look at each complication to find the cause, because what we try to do is ascertain the cause. Once we get the cause of the problem, then you're able to actually fix that particular problem. Of course, as we're gonna expand on the magnesium now. Now, of course, the magnesium for persons, you have basically calcium that can build up in the arteries, and that can cause a little calcification. Magnesium is basically a natural calcium blocker. So, in other words, it will stop the calcium from building up in the arteries, and that's the importance of the use of magnesium. Most people will use magnesium glycinate, there's citrate that also works pretty good. Most, of course, all of that will come from a lot of greens that person is using, and then person can definitely get magnesium supplement to use if they have high blood pressure, because it works pretty good to get persons
What
back
what
on
we
track.
what we normally recommend is that they can Google all the foods that are high in magnesium, natural magnesium,
Yes.
and they can apply it to their diet. You know. So, but before we end the chat, I will give a natural recipe to bring it on. A natural recipe. So just remind me, Dr. Thompson, to give that out for people who want something to lower their blood pressure.
Sure.
Magnesium naturally is a mineral that is used by the body in high frequency. It is necessary when people get cramping. Low magnesium levels lead to poor sleeping habits or insomnia. It also it helps with the flexibility and the dilation of the arteries. So it's a very important mineral, very important mineral. Okay, so
Definitely.
especially for high blood pressure. It's
Yes.
as a
Actually.
matter of fact,
Mhm.
I've heard a lot of doctors say that is the cure for high blood pressure. A lot of doctors come in and talk about it, how important magnesium. I have a book on it. I've read a lot about it, and it does so many things in the body. Right, so it's one of the most needed minerals besides calcium. Calcium and
Right.
calcium, as we call it, calcium and magnesium. You know.
So definitely, right. So added to that, of course, what are some of the causes of high blood pressure in the first place, or what are some things that could actually affect a person that they can lead on to developing high blood pressure?
Well, again, because it's a non-communicable disease, and of course, you also have genetics. We have genetic plays an important part in it. Now, it doesn't mean because your parents or it's inherited in your family that you necessarily have to become hypertension. But many people are trained to eat the way their parents ate. Okay, from small, they give you the foods that they ate and they were probably hypertensive. So we need to break that chain of eating habits. Of course, it's all has to do with diet and lifestyle. Um, so if you have um, the the history in your family, you have to be careful. High salt content in food. I'm talking about sodium chloride. I'm not talking about sea salt and Celtic salt or Himalayan salt. These salts are not just sodium chloride, but sodium chloride tends to thicken the blood, okay, and it tends to spike the blood pressure. And a lot of the foods that we eat, all right, because there's a certain amount of sodium we are supposed to consume on a daily basis. We exceed that sometimes 3, 4 times more than the daily dosage. Okay? And that after a while could have its consequences on your body. All right? Um, Not only that, but you can also have lack of exercise. Persons who live a very sedentary lifestyle, they sit down on a couch and they're watching a television whole day. They're not exercising, right? They're eating the wrong foods on top of that. Lack of exercise can also contribute to hypertension. Okay? People who have insomnia, um, they usually have high blood pressure because they're not getting enough sleep, or sometimes people who have to work in the night. You understand? They work 2 shifts. All right, that also could cause blood pressure to rise. I remember a little example of they took healthy soldiers. This was done in the U.S. Army. They took 5 soldiers and they kept them up right through. None of them had a history of high blood pressure. None. And they kept them up for 24 hours. Didn't let them sleep. Each one of them, their blood pressure went up. Every single one of them. And they were not hypertensive. So, you know, um, as I said, there are a lot of causes to the blood pressure problems. Um, but then again, lack of the exercise, not exercising, you know, that leads to complications as well. I don't know if you have any other there are
Right. So
a lot of
yeah,
different causes.
one of the thing is dehydration. Once person
Uh-huh.
don't drink enough water, automatically your blood pressure start rising because you're gonna put pressure on the heart to pump the blood. Of course, as you see in
Very
the
true.
picture here, you'll see an
Yes.
enlarged heart. That heart has to pump a lot of blood. If that heart is
Thick
not
blood.
pumping enough blood, automatically the blood pressure starts going up. So untreated, all right, untreated, the disease can lead to atherosclerosis of or basically congestive heart failure. So, to treat high blood pressure, it really brings about a healthy lifestyle itself. So, as you said, from exercise to sleep to drinking enough water to eating proper nutritious diet itself, with nuts and grains and fruits and vegetables, especially greens, because those greens will power the endothelial lining so that nitric oxide can be produced properly. And then that actually helps to keep the blood vessel nice and elastic so that blood could flow easily so that you don't have hardening of the arteries. To
Yes.
add to that, too, some person may be using things like coffee, and too much of coffee definitely would affect the nerves. The nerves control the muscle, and if when you damage the nerves within the body, automatically your blood pressure starts going higher than normal. Blood
I have a
sugar,
question. Yeah, I have a
sure.
question, Brian. What maybe you can explain this. What it is, why it is that when people get up in the morning and they feel tired and they drink a cup of coffee and it perks them up and they wake up. Where does that energy come from?
But basically, that comes from the chemical compound called caffeine. Right? Caffeine is a stimulant, so it stimulates the body. It stimulates the nervous system. It
All
stimulates
right,
dopamine in the brain. All right. So usually, in that case, a person will reach into a stage where they get a high, and then all of a sudden, the energy drops drastically throughout the day.
right. And this is why people are always looking at all these energy drinks too. All these energy drinks are chock full of caffeine, you know, or the weight loss pills. They use caffeine in it, so it
Mm-hmm.
boosts the energy, and that has its effect on the heart and the blood pressure. I've known people who've had strokes and heart attacks are using these energy drinks because they drink it to boost the energy. Some of them use it with alcohol, which is very dangerous. I know of a particular person who died because of that, using an energy drink and alcohol. I think it was punching rum or something. So, and he got a massive stroke and went into a coma, and eventually he died. So
Yes, so
these are
yes, there are many causes, but there are also many solutions to the problem. All right. So
absolutely
at this time, I would like you to give that particular recipe, and persons can always call in to get that recipe. If it's the same recipe that's on the booklet, when a person does a live blood analysis, they'll be able to
yes,
actually get that
yes.
recipe in the back of the booklet as well.
But there will be some people that will not be able to maybe come to the clinic, so we're going to
Right.
give it to them anyway.
No
It's,
problem.
it's, it's better to bless people, so because you have people out there who may not have the funds, or I will give it to them, and it's 1 tablespoon of raw cocoa powder. That's the cocoa powder that has no sugar, nothing. It's just cocoa powder. They have the Cadbury, they have the Chief brand that has the raw cocoa powder. 1 tablespoon, right? Um, 1 tablespoon of black seed oil. That's black cumin oil, black seed oil, and 1 tablespoon of flax meal. You can take the flax seed, grind it, and you get the flax meal, or you can buy the flax meal. You take those 3 ingredients, you put it in a teacup of warm water, right? And you drink that once a day. That naturally, gradually brings down the blood pressure. If you're taking blood pressure medication, you need to check your blood pressure, because if you're taking that, you can drop the blood pressure too low, right? So that's important to make sure that you're monitoring your blood pressure when you're on this recipe. Okay?
Right, so great. Wonderful recipe, actually, that works pretty good. And for persons who has chronic high blood pressure, definitely you will have to visit us at Eden Heights Clinic. We have two locations, which one is in Trinity and one in Chaguanas. Right. So if you actually want to take a view of this video again, you can get it on Eden Heights YouTube page. You can YouTube channel, sorry. You can get it there. You can actually go back and watch some of our videos that we had there before. And by God's grace, we'll be able to continue sharing so much more information with you. All right. So take care, everyone. Have a blessed day. And I hope all goes well today. Right. Hopefully, by God's grace, we're going to be back on live again at 2:30. Stay tuned. We're going to be talking about peripheral artery disease. Okay. So that is the topic for later on today. All right, you don't want to miss that one, especially those that are having problems with their feet and cramping and numbness and so much more. And Dr. Navarro here is entertaining everyone there. All right, have a blessed day, everyone.